Welcome back to the morning show here on Arise News. I'm Biola Lavi.
Welcome back. I'm Veronica Odeka.
And I'm Tundu Abiola.
Cancer has been plaguing humanity throughout recorded history. Whether malignant or benign, it is one scourge that medical science has not been able to make an impression on, let alone conquer. But even among the different forms of this deadly alignment, breast cancer stands out as a silent killer. In Nigeria, which is still a largely conservative society, most women going through trauma of breast cancer are still underreported because of several factors. Majorly, the traditionally induced reluctance to expose one's bodies to strangers. We're now being joined by a United States-based health and wellness expert, Dr. Nesochi Okeke-Igbokwe, and Tolulope Falowo, a cancer control advocate and founder of Cancer Aware Nigeria, to talk to us about this disease and the basic things women should embrace in order to stay safe.
Good morning.
Morning, everyone.
Good morning. So just so our people at home know, Dr. Nesochi.
Nesochi.
And Dr. Tolu. Thank you. Thank you both for being here this morning.
Thanks for having us. Thank you.
One of the things that in the introduction said is that breast cancer is underreported in Nigeria. And you guys have a foundation that actually is trying to raise awareness on breast cancer. Can you tell us a little bit about the foundation and why you both felt it was important for you to have a foundation here in Nigeria?
Okay, thank you, Biola. Cancer Aware Nigeria was set up about 4 years ago to address the rising scourge of breast cancer in Nigeria. We realized that a lot of cases of breast cancer presented in the country was late stage. So women were coming into the hospitals with advanced disease. And there are many reasons for this. The main one is ignorance. So people don't know what to look out for. A woman sees a lump and then she hopes it will go away, or she doesn't know who to talk to and all that. So we started Cancer Aware to address these issues. Another huge factor that is causing women to come late to the hospital is poverty. The fact that we have to pay out of pocket for our health services is a huge factor. In the West, most of the countries, breast screening, cervical screening is free or heavily subsidized. So that is an incentive for women to go to the hospital. So Cancer Aware is trying to address this, and we've recorded quite some success in the last 4 years. There's still a lot of work to do. A lot of women across the country still don't know about breast cancer, still don't know about the symptoms or signs, but we're getting there.
So hold on just a second. You mentioned two good things. You said one of it definitely has to do with poverty. So when you say that you help them address it, how specifically do you do that?
Okay, so the main core of our work at Cancer Aware is our community health outreaches.
Okay.
So we go to underserved communities. For now, we're doing Lagos and environs. Okay. So we take screening to these women who ordinarily would not, cannot afford it, or would not even know they need to screen. In addition to that, because when you screen large numbers of women, you will always find abnormalities. You will find cancer. So we set up a patient support initiative whereby when we do find abnormalities, we support with treatment.
Okay. So quickly, Doc, help us understand.
Yes.
What is breast cancer, first of all?
Okay,
so break it down for us.
Surely. Simply stated, breast cancer is an abnormal proliferation of cells. What that really means is that we all have in our body healthy cells. So sometimes the healthy cells become damaged, and when those healthy cells become damaged and start growing out of control, then you can have a cancer. If this process goes on within the breast, this proliferation or rapid growth of these damaged tissues in the breast, that's when you have a breast cancer, which you may see as a lump in the breast, or which testing or screening can show up on some kind of an X-ray like a mammography.
So screening is important.
Screening is essential.
How do you do screening, and how do you do it so that it doesn't cost you so much money?
So just to discuss the three main modalities of screening, we talk about just first breast self-awareness or your self-breast exams, meaning that every woman should really know at baseline what their breasts look and feel like, so that when you have any of the changes to the breast that could be a symptom of breast cancer, then you go to your doctor and let them know, hey doc, I'm seeing this kind of change. Do I need to do something about it? Okay. And the main symptoms I think that women should know about, because most people really only know about the lump in the breast as the main symptom. That's not the only one. Things to look out for are, for one, nipple discharge. If you're not a woman that's lactating or breastfeeding, and if you're having abnormal expression of any kind of fluid from the nipple, that's one red flag. Another red flag to look out for is inversion of the nipples. If you at baseline don't have inverted nipples and all of a sudden you see this change, you need to go see your doctor immediately. And another important skin change that you could see is just dimpling of the skin. So when you look at an orange peel, there's something that we call peau d'orange. So basically the skin of the orange, the way that that looks, if you start seeing that dimpling and puckering on the surface of the skin, that's another sign that you need to see your doctor immediately. And finally, if you have swelling or any kind of skin rash or thickening that just doesn't seem to go away, you need to see somebody as well.
So how often are we supposed to be doing this? And is it that you have a day? Should we pick the same day every month to say, okay, I'm going to do this every 22nd or every, and also what days should we avoid? Because I know that doctors also say avoid certain
So when we're talking about the breast self-examination, usually you can try to do that once monthly. You can do that just laying on your bed, in the shower, and the way that you do the exam, basically lifting one arm up, using the opposite arm to go in a circular motion just to check.
Does it matter what arm?
It doesn't. You're going to use both arms because you're checking both breasts. So if you have the right
opposite,
exactly. So let's say you have the right arm up, you're going to use the left to go in the circular motion to check for any lumps, bumps, or any changes that you may see, and just try to express any liquid or fluid from the nipple to see if anything does come out. So these are things that you should be doing routinely. But the other screening modality is what we call the clinical breast exam, which you wouldn't be doing yourself. It's when you go see your doctor or a medical professional. They do the exam for you on the examination table. Okay.
So I'm sorry, I have one more question about this because it's with breast exams and also screenings, when do you start doing them? What age? And then how often do you? Because there's a lot of controversies around this. Especially when you also get to the mammogram age.
Exactly. So there's
all the controversies. So tell us.
There's a huge controversy, and different regulatory bodies and groups have different regulations for this. So in general, when we're talking about mammography, if you are a woman of the age of 40, that's when you start and initiate that discussion with your doctor, unless you have a positive family history, meaning that you have a parent that had breast cancer or a sibling that had breast cancer. You may be initiating the conversation sooner to decide how often and when you'll be screened. But in general, it's around the age of 40, you have that discussion, and you may begin screening with mammography every 1 to 2 years.
Which has changed because at one point it was like once you turn 40, you have to go.
You have to do that. But there's a lot of controversy, but based on your family history, your own personal history, any other medical conditions you may have, you sit down with your doctor, have that discussion to determine what screening would be most appropriate for you and the frequency that you are going to be doing that.
And pre-40, it's almost sort of just this monthly stuff. If you see anything, any red flags that like you've mentioned.
Exactly, then you go in and see your doctor and talk to your doctor about that.
Okay, so this is preventative stuff.
This is preventive because if you catch it soon, you have better health outcomes and it's more treatable. Most people, especially in Nigeria, when they do present, they present at later stages when it's almost kind of too late to do anything to help, treat them appropriately and accordingly.
What is the treatment? What is the treatment like in Nigeria for breast cancer?
So when we're treating breast cancer, there are a few treatment modalities, but everything depends on the staging of the breast cancer. So in general, your doctor can decide to use a combination of things, which may include surgery, chemotherapy, and radiation. But all that is determined by how advanced the cancer has spread or where the cancer is at.
I want to know just on some numbers, so which would kind of help women become more aware and encourage them to kind of get screened. If you have any statistical numbers to share, saying that if it's caught early, based on what you know, the chances of it being treated well enough for people to have a successful recovery. What are some? Do you have any numbers that you can share?
Like if people find out, the earlier you find out, what are your chances of?
So, I mean, in general, there's an inverse relationship, meaning that the earlier that you find out, so if you are stage 1 or you just find some kind of lump in the very early stages, that means your chances of recovery and getting the appropriate treatment are improved much greater than someone who is at stage 4 or where the cancer has metastasized to other parts of the body. At that point, chances are much lower. There are treatment availabilities, but your chances are much less than somebody who came in initially in the very beginning stages.
So I want to ask this also. So what are some of the myths surrounding breast cancer? Also because I know people that they've had a history in their family and they feel that, well, I've had it and that was like so long ago, there's no need, I'm okay. And then there's some people who are saying, no, we don't have it in our family, I don't need to get checked, it's okay. What are some of the myths that surround?
So does that mean like they skipped a generation, so they don't believe?
So they probably don't believe in it because they might not know.
I wanted to say something about the numbers. Unfortunately, the numbers we have in Nigeria are the bad numbers, in quote. That means the number of fatalities.
Yes.
So according to the Globacon report, every day in Nigeria, about 40 women die from breast cancer.
Sorry, say that again?
Every day in Nigeria, according to the Globacon report, 40 women die from breast cancer in Nigeria. And at our charity, we've seen all sorts. Our youngest support patient was 18. We've had a 75-year-old. So that's why we're on this trail, to let people know that breast cancer is very real. It cuts across age, demographics, social status, everything. So women need to know what their breasts normally look like. Regarding misconceptions and myths, the number one is that breast cancer, all cancer, is a death sentence, which is very untrue. So people think once you have breast cancer, definitely you're going to die. And this is untrue. Like Dr. Nesochi has said, if it's caught early, it's treatable, it's curable. Even in the later stages, it's still curable to an extent. But we want women to present...
I didn't even know that.
We want women to present earlier.
I want to know what support is available for cancer patients in Nigeria. What support, what sort of treatment is available? Do we actually have the facilities?
That's a very good question. We, unfortunately, not. Things are getting better, but there was a time a couple of years ago that there was no radiotherapy machine working in the whole country. And doctors will tell you that radiation is one of the critical parts of cancer treatment.
Sorry, I thought that they had one in Abuja.
Yes, I said a couple of years. So now it's different. So we have one in Abuja, we have in Ibadan. Lagos is coming up with 2 more at Luth by first quarter of 2019. So things are looking up. And this was as a result of advocacy from cancer organizations such as ourselves.
Yes.
The guidelines is that it should be 1 radiotherapy machine for 1 million people. So ideally, we should have about 200 in Nigeria. You know, so yes. So there's chemotherapy, there's surgery, like she said, and most tertiary hospitals treat cancer. But we need to do so much more. At our charity, we are overwhelmed with calls and requests from people requesting for support. There is no social support. There is no universal healthcare coverage in Nigeria. Is still coming up. We're not there yet. So people have to pay out of pocket. I've seen cancer throw people into poverty, even middle-class people. You know, when you're spending between 2.5 million to 10 million to treat 1 case of cancer. So we need more to be done. We need people to talk about this. We need the government to do more to help more people.
Does the foundation support treatment?
Yes, we try. Unfortunately, we can't do much because it's expensive.
Sure.
So, and we rely on funding and donations. So it's the little we can that we can help people with. We want to do more, but unfortunately, we can't.
Doc, one of the things I was reading a few years ago about breast cancer is that breast cancer in Black women and in Nigerian, which would then be Nigerian, is slightly different from the breast cancer that has been researched and treated. I mean, there's so many more treatments to it. So there's some people that are doing specifically research around how breast cancer behaves in people of Black descent around the world. Have you heard about that, and do you have any sort of insight on what that means and what we should be aware of?
So the body of research that is available basically shows that in general, Black women do not get the treatment that they need soon enough or early enough when we're talking about cancers in general and even breast cancer. So in focusing on that population, basically the message is early detection and better screening modalities for women. or Black women, I should say, specifically. But the main thing I think that needs to be done in order to have that happen and allow people to know that they need to be screened early is to kind of remove a lot of the myths that surround breast cancer. So I'm glad you touched upon that earlier, because I get patients that come in a lot with specific myths about breast cancer that kind of deters them from not wanting to even see a doctor or thinking that they are at risk for breast cancer. So like you stated before, some people think that if they don't have a family history, then they're free from the risk of breast cancer. That's not true. Every woman is at risk of getting breast cancer by virtue of being women.
Is there a percentage? Is there a percentage that we all start out with? Just
well, at baseline, everyone is at risk, but everyone has different sets of risk factors. It's a multifactorial approach when you take to determining your risk. There are different things that put one at risk, things that we have control over, things that we don't have control over. The things that we don't have control over, the one huge risk factor is age. We're all going to age, so we have no control of that. So as you get towards the age of 50, most of the breast cancers that are diagnosed in that population of women that are 50 and above. So as you get older, that increases your risk. Also,
does menopause have anything to do with that?
Yeah, I was just going to mention that as well.
Because you said 50, so.
So another risk factor that you can't control is your reproductive history. So women who enter menopause at later ages, that is after the age of 55, and begin their menstrual periods at an earlier age, that is earlier than 12 years of age, the longer that you're in that kind of bracket, you're increasing your risk because you are exposed more to hormones during that time frame. So that's something that you can't control as well. And of course, your family history, you can't control that. If you have a parent that had breast cancer or has breast cancer, that increases your risk as well. But then we have the controllable risk factors. So that's what people really should focus on. And these are the lifestyle choices that you make.
I was going to ask that. Does diet and where we live in our country, does that have anything to do with affecting, we talked earlier and they were talking about population, pollution.
Yeah.
So I'm like, does the air we breathe, what are some of the things that we should be aware of that we can't control but we should know?
So the main things that you do have control of, your diet and your exercise.
Okay.
So the body of research that's out there shows that
Here we go again, diet and exercise.
Basically tells us that if you are a woman who is obese during your menopause years, you are at an increased risk of getting breast cancer. So work on your diet and exercise and maintain a healthy BMI and a healthy weight.
Wow.
So that's something very important to...
What do you think about the argument for raw diets, vegan, and this soursop smoothies that people are banding about at the moment? Does that have any scientific backing?
So here's the thing with dieting. A lot of these fad diets, there's not much scientific evidence that really backs all these things up. So if you really want to stay healthy, you just have to maintain a well-rounded diet. Make sure you're having all the food groups in there. You're avoiding processed foods, you're avoiding fatty foods, you're avoiding highly saturated foods, you're avoiding fast foods with all those chemicals that go along in it. You're eating a very healthy, well-rounded diet that has all the nutrients you need to sustain the body.
You're not having too much fun.
Exactly.
But you live longer. Thank you guys so much. I think you've given us a lot to think of, and this has really been helpful on the back of our conversation about fertility. Thank you so much for being here. We hope you'll both come back. I think that this is, the work you're doing is amazing around raising awareness, and we hope you'll come back, and let's make this a regular part of our conversation on women's health.
Absolutely.
Thank you so much.
Thank you for having us.
Thank you for having us.
Thank you.